Hello everybody, it's Dr. Salem here at Ivanhoe Dental. Today I wanted to do a first tutorial or a patient education video about dentures, but dentures that are supported by some type of implants. So if you have a mom or a dad or a friend who wears dentures and complains that they don't fit very well, which is the case with most dentures, then have them look into some implant supported dentures. Today we're doing a bottom denture for this lovely patient, and bottom dentures really don't have much support, right? Most of the time our tongue is what sticks in between this space here, and bottom dentures tend to move around, they don't stay in. Many patients feel embarrassed. So at Ivanhoe Dental, we have implant technology that can help our patients and support these dentures to actually keep them in. So I'm going to show you guys a model here of a denture, but it's actually supported by 4 implants. Now the implants are under the gums. What's here at the top are what we call posts, and this is what helps keep the denture in. Now the ones I'm putting in are gold. Yes, a little bling bling. So I put gold posts for the patients here. So the way this works is we're going to install 4 posts, and then I'm going to install 4 magnets on the inside of the denture. So there's 4 magnets that I insert inside the denture, and they're going to snap in to these posts over here. So if we can maybe get close and see if we can hear it snap. I guess there wasn't much of a snap here, but they're snapped in, and I'm pulling up on them. I really got to pull out to get them out. So with these magnets and these posts connected together, a patient can bite into an apple, eat comfortably, go have a cup of coffee, not worry with friends that my denture's going to talk out. So this is the life-changing procedure that we're doing today. Can we get a little bit closer so we can see the implant under the gums? Do we see the head of the implant there? There's an implant on the inside. Maybe we can show with the reflection. See that metal piece? Do we see it? Yeah. So, yep, right there. So basically what I'm doing now is that I'm installing the gold posts which engage inside the implant. So they just screw right on. All right, let's get this in there, and then basically I just hand tighten it in there. And then I'll use a little torque wrench at the end. Voila. So it's hand tight right now. And then I'll torque them at the end. So there you go. That's the 3rd one. And I'm going to install the 4th one. So typically we do 4 implants here. All right, so the next step is I am going to place the magnets on these posts, and then I will place some dental glue in the denture that's going to pick up the magnets. And you'll see here in a sec what I'm talking about. This is called a spacer, which basically makes sure that my magnets don't lock into my post, because we definitely don't want that to happen. All right, beautiful. We got our 4 spacers installed. There's 2. There's 3. And there's 4. Alrighty, so once I get these guys hand tightened, I got to torque them with my torque wrench to make sure they don't become loose. So that's what I'm doing right now for each one. This is the resin or cement that we use to fill in 4 holes that I made here in the denture. That's going to grab on to my 4 magnets that I have over here. So I'm going to fill these holes in. just like a pink glue, as you could see. Alrighty, so let's go ahead. Let's insert this. One open, please. Make sure it's down all the way. Just put a little pressure. Just relax. Bite down. And look at that 1 sec here. So this does dry on its own 5 minutes, but I like to combine both self-drying time, and then I'm going to use a blue curing light to help speed up the process faster, excuse me. And as you can see, this denture came out beautiful. She has a top denture at the top, one at the bottom. Let's look at how nice that bite looks. Look at that. Look at that bite. Beautiful. And turn over here. Thank you. And let's go look at this side. Bite down. And look at that. And turn this way. Beautiful bite. All right. Thank you. We're going to do 20 seconds at each post to make sure that it's integrated inside. As you can see, look at that. I'm grabbing it. This thing would come out easily without these magnets. I really got to push up, excuse me. Perfect. Okay, let's try to lift it up. Look at here. I'm grabbing your whole jaw. This thing ain't moving. This thing is definitely not moving. All right, one more time. Let's pop it off. Okay, snap. There we go. Bite down. There you go. Yeah. So for you, every patient has a different trick. For you, you can line them up like you just showed me, and then bite down to make sure they're insecure. Okay. And they are, right? Yeah. Beautiful. Was this worth it? Let everybody know.
Yes, it was worth it.
Did anything at all hurt today?
No, actually it didn't. No.
And did your initial surgery 4 months ago to get those implants in there, did that procedure hurt? Be honest.
No, it didn't.
Because you were sedated, right?
Correct.
Gotcha. Would you recommend this to future patients?
Yes, I would.
And I will be making a little debrief session for all our lovely patients out there, future patients, and people that are just curious. And I usually always schedule, it's a must, a 1 week follow-up with the patient to make sure they are doing fine, make any necessary adjustments to make sure that they're happy and healthy. Stay tuned. Thank you.